Hi everyone, myself Niveta from first MSc Microbiology, Sacred College, Tirupattur, and my topic is about Neisseria meningitis. General characteristics of Neisseria meningitis: gram-negative bacteria. It appears pink color, shape spherical cocci, and the arrangement is diplococci. Diplococci is nothing but cocci arranged in pairs. Motility non-motile. Capsule is occasionally present and the endospore is absent. It is aerobic in respiration and the optimum temperature is 35 degrees Celsius to 37 degrees Celsius and the pH is 7 to 7.5. The types of serogroups are A, B, C, X, Y and W135. The habitat is normal human flora on nasopharynx. Nasopharynx is nothing but upper part of the throat that lies behind the nose. And then it discovered by Anton Weisselbaum, Austrian bacteriologist in 1887 from analyzing the cerebrospinal fluid of patient infected with meningitis. Meningitis is nothing but infection in brain. Pathogenicity of Neisseria meningitis. Neisseria meningitis are transmitted by inhaling of infected droplets by sneezing or coughing. Incubation period 3 to 4 days. And the virulence factors of Neisseria meningitis are capsular polysaccharides, IgA protease, plasmids, fimbriae and pili proteins, lipopolysaccharides, pore A and pore B proteins, OPA and OPC proteins, ion binding or accusation proteins. Pathogenicity of Neisseria meningitis. Neisseria meningitis first affects the mucosal membrane surface such as nose, throat, respiratory tract by attaching with it pili. And then it infects the tissue until it gains access to the bloodstream where it then travels to infect the meninges of brain. It produces antiphagocytic capsular polysaccharide, a coat that contains highly variable surface, and it produces large amount of endotoxin and during the exponential growth phase. Normally, it affects the immunocompromised person, which has highly mortality rate on children. Clinical disease caused by Neisseria meningitis. Meningitis, meningococci, pneumonia. Meningitis, pleural inflammation of meninges associated with headache, meningeal signs and fever. Meningitis has high mortality rate which is treated with antibiotics. Meningococci, disseminated septicemia infection characterized by thrombosis of small blood vessels and multi-organ involvement. Small pedicle skin lesions combine into large hemorrhagic lesions. Pneumonia, milder form of meningococcal disease characterized by bronchopneumonia in patients with underlying pulmonary disease. Laboratory diagnosis of Neisseria meningitis. Microscopic examination, gram staining. It appears pink colored gram-negative cocci arranged in the form of coffee bean shape. And then motility non-motile. Colony morphology of culture medium. Blood agar. In blood agar, gray circular colonies with gamma hemolysis. And Mechanki agar with white colored non-lactose fermenting colonies. Selective media for Neisseria meningitis, Thayer-Martin medium and New York City medium. Thayer-Martin medium, Thayer and Martin used vancomycin, colastin and niacin. Martin and Lister used an additional antibiotic, thiomethoprim, to make the medium selective. Medium to large, blue to grey, smooth, moist, mucoid, glittering, circular or round, transparent colonies. New York City medium, medium to large, blue to grey, smooth, moist, mucoid, glittering, circular or round, transparent colonies. Biochemical test: catalase positive, oxidase negative, urease negative, glucose fermentation positive, IMIC test is negative, starch hydrolysis negative, casein negative. Antibiotic therapy and prevention. Breastfeeding infants have passive immunity for 6 months. Treatment with cefotoxin or cefotriaxone should be initiated. If the isolate is penicillin, suspected treatment can be changed to penicillin G. Chemoprophylaxis for contact with person with the disease is with rifampin, ciprofloxacin or cetatriaxone. For prophylaxis, vaccination is an adjunct to chemoprophylaxis. It is used for only serogroups A, C, X, Y and W135. No effective vaccine is available for serogroup. Thank you.